There are some conversations that we must make comfortable in every household and society as a whole. There are also moving stories of perseverance and purpose that not only uplift others, but inspire us all to think and reach higher in hopes of positively affecting someone else. Throughout my journey, I've been fortunate enough to have been a part of some amazing conversations and witnessing wonderful stories of transformation, including my very own. And now I share them with you. Your stories, your narratives, our inspiration. I'm Cory George, and this is One on One.
My name is William Sanchez. I'm in the School of Psychology, PhD program. I work with children with autism and behavioral disorders as a psychologist, not only improving their quality of life by being a psychologist, but I'm also creating positive social change and enhancing their quality of life.
And so thank you for joining us for this episode of One on One with Cory George. And studies show that receiving mental health care and advice from a culturally competent mental health care professional can increase trust and can also result in increased positive outcomes for mental health patients. My guest for today's conversation understands the importance of his presence in the mental health care scheme, and he's here with us to talk about his journey of becoming a psychologist. I'm so delighted to have Dr. William Sanchez on the show, and so thank you so much for taking time out to join us on the show today.
Oh, you're welcome. Thanks for having me, Cory.
So, so I was intrigued because I had never come across a Latino male psychologist, and I like to, and I like to have the audience understand your upbringing, and perhaps after that, talk about what inspired you to become a psychologist.
Well, to start it all off, I grew up in a predominantly poor neighborhood in the Jamaica section of Queens, New York City. Um, so my upbringing was it was decent. I didn't have any traumatic issues, but we grew up predominantly poor. My mother raised five children, single working mother who actually was on welfare most of my life. Um, so she, it was a struggle for her to support five kids on her own. We lived, we even though we had food on our tables every day, or it was still a struggle. She did what she had to do to kind of feed us and to make sure that we were well kept. Um, but I wanted more. I figured, living and growing up in Jamaica, Queens, there was a lot of disparity, you would say, poor people all over the place. And I just felt like I needed more. So I put myself through school. I got interested in the field of psychology a long time ago because I have a passion for analyzing, I guess, and studying human behavior. So what motivates us? Why do we do the things that we do? And that's part of behavior analysis, part of psychology. So the field of psychology caught my interest a long time ago. Um, so there's a lot of factors that contributed to my upbringing and to my wanting to be a psychologist. But my mother was the biggest factor. Although there's no significant mental health disorders in my family or family history of, I did run into a lot of situations where, for example, I suffer from anxiety. So I guess growing up, I just wanted to know why I'm so anxious. What motivates me to be anxious. So essentially, my upbringing was it was decent, but it was what motivated me to move up in my life and further my career and my education.
Well, awesome. So what I hear are two things. I hear that you dealt with anxiety, and I think that is very important for people who are watching to understand that just because you're dealing with a life issue doesn't mean that you shape your expectations simply because you have a disorder
Yeah.
and that you can dream beyond that. And secondly, that your upbringing for some people having experienced the same thing would have been a factor where they may have thought that that was the ceiling, that's all that
Hmm.
they could expect. But you decided that you wanted more. You know, you decided that for you there was something extra that you needed. So I wanted to find out, being male, being Latino, and gay, Did you have any role models, or did you have anyone that you looked up to that further inspired or mentored you into this career path?
Actually, to be honest, I did not. Typically what would happen, people would normally say, oh, my father was my role model, my mother was my role model. I
Mhm.
didn't have that male figure in my life. My father passed away when I was in my late teens. He passed away very in a traumatic experience, a traumatic way. But my mother was my role model. I saw my mother struggle. I saw what she went through to put food on the table. I saw the struggles of her waking up at 4 o'clock every morning to go to work,
Mhm.
to just survive. But again, I didn't want to just survive. I wanted to push myself. I have my personality, my characteristics is I'm a very motivated person, and I'm a very determined person. So when I say I'm going to do something, I usually end up doing it. I'm a go-getter. So I worked as an EMS worker overnights. I traveled. I lived in Pennsylvania, and I commuted 2 hours every day to work on an ambulance.
Wow.
Um, so that put me, that helped me put me through school. Um, and also seeing everything that I saw working on an ambulance, I figured, hey, listen, there's a lot more to meets the eye,
Yeah.
So that's what pushed me to become into the field of psychology.
Mhm.
So I ended up earning a bachelor's in human services. I ended up earning two master's degrees and a PhD in psychology.
Wow. And so like you, when I was raised, we there were a lot of times where we were raised in raised in circumstances, whereas again, I could have just been a product of that. My mother was on welfare. She was a single mother most of the time, raising four kids, and I was the oldest. So I call myself the target baby, the practice child. So, and it's okay now, but as a child, you don't understand that just like you're learning to be who you are, your young parents are also learning how to parent. There's no book on it. And what I value most about what my mom did, my mother never told me that this was permanent. She never instilled that this is your limit. So I never thought that that was it. I never thought that where I was where I was supposed to be. I figured it's temporary. And then what also motivated me was probably my senior year in high school or junior year, she enrolled herself in a vocational college. And I was a smart high school kid, but I would come home and see her every night studying vocabulary, studying terms, studying every night. And she would sit in her bed, and she didn't even notice I was looking in her room, and she's really studying every single day, made straight A's in her vocational college courses. And I said, wow, even in the midst of when she's trying to pay bills or having difficulty, or we are receiving, these handouts from charities, she's saying, I still want to better myself you know and so subconsciously I think that told me that there's more than what we are doing now, so I can understand how choosing experiences higher than what you've experienced can be easier for some people. um, in your family, I want to know, um, were so are you the oldest child? Are you the middle child? So
So
what do you think
I'm
of
the second. I'm the second of five.
that? Okay.
The oldest, yes. So the oldest is a year older than me.
Okay.
Uh, I was the very first one to attend college.
What do you hope your contribution is to the field of psychology? Well, yeah, well, psychology when it's all over. What do you hope to to make your pen statement in
So
terms of
so so what has caught my interest in the field of psychology? Because there's several, I guess, strikes that I have. I'm a minority. I'm a
psychology?
Latino. I'm a gay male. Um, I was also just recently recovering from COVID. But there's a lot of disparity and stigmas in the Latino community,
Yeah,
especially when it comes down to mental health. So I think that is a big factor for me, and kind of exposing it and just saying, hey, listen, just because you have a mental health disorder, or just because you have that Latino machismo, vibe, that it's okay to see a therapist, it's okay to see a psychiatrist, it's okay to have anxiety or depression.
yeah.
Um, it's okay to be gay and have an issue.
Well, also what I notice is that, so when we go to our provider directories and we're looking for, providers, and your name, the last name Sanchez has to stand out for other Latinos that are looking for someone that may understand the struggle from a cultural aspect. So in your opinion, how important is it for minorities uh, to be in service with a culturally competent mental health care professional?
So that's one of the barriers to the Latino community in mental health is the language barrier. A lot of psychologists or psychiatrists or therapists, it's very hard to find a therapist or psychologist that speaks Spanish. So language barrier is a huge issue. The fact that growing up in a Latino culture, it's a stigma to have that you're loco or you're
Yeah,
crazy,
yeah,
stigma. So essentially it's a lot of Latino cultures don't like talking about their issues. So education is important because you know I might be able to go to a therapist now and talk to a therapist, but my mother might not, you know,
definitely.
feel comfortable talking to a therapist because she's, that older generation. They didn't grow up talking to a therapist. Her her uh, her stance on it was like, all right, I'll get over it.
Well, you also mentioned the word machismo, which is also a barrier because someone may not understand how to work through someone's machismo in order to get through to them but to not also work through it, but to also respect that it's there instead
Hmm.
of telling them, oh, you have to open up or you should, as opposed to saying, I understand, and even if it's not verbal, but you understand that's part of the cultural thing with, with men in that culture. They don't, and well, and also we have to also consider a spiritual aspect is, at least for my culture, for Black people, we would rather go to the church first
Yep.
than see a therapist. And if our pastor says we see a therapist, oh, we have affirmation that we should do it. So sometimes the culturally competent therapist, and it could be of another race, but if they're not culturally aware, they may rub up against that culture, and it can look like insensitivity.
Hmm.
It can look like a form of disrespect or a form of ignoring who I am, not being seen and not being heard.
Yeah.
So
Uh,
that's why I feel like people like you and people like me, we help fill the spectrum for people who need people that look like us.
oh yeah. Listen,
So yeah.
there's been times where I've seen my own therapist. I've been through my situations
Hmm.
in my life where, I felt the need to see a therapist. I've been to that dark place,
Yeah.
suffering from anxiety, and I went through a recent a divorce. So it takes a toll on you, and having that other person that's not biased
Right.
can help you oversee that, and overcome those obstacles. Because when you're in a dark place, or when you're suffering from anxiety or depression, it's hard to get out of it if you don't know the resources. If you don't know what to do and how to utilize your resources, you can fall very deep into it.
True. And you said a very great thing is that I'm a psychologist who has a therapist. And I've always said in a lot of my broadcasts is I may know a lot of stuff about mental health, but I'm also human.
Yep.
And I have two children that see therapists. And I always tell my kids, and I've told my husband this recently, is that there are some things that I'm so close to because I'm a dad, I can't be their counselor.
Hmm.
That because I can't take off the dad hat. So we have to understand our boundaries, but also understand because we're human, um, we can also facilitate our own change, by seeking help as well. So, and I think the misnomer happens when you perhaps meet people and they experience you and they may think, oh, you don't have any problems, or if you do, you can rebound just as fast as me because you can help yourself.
Yeah.
Well, sometimes that's true because I know things that you may not know, but there are
Hmm.
times that I'm just like, I can't do this by myself.
Yeah.
And it's encouraging to know that I have the openness and you have the openness, to say when it's dark and I can't pull myself out, within a reasonable time frame, it's time to seek that lifeline. And it could be a therapist, it could be friends who are great at helping you to understand that you're more than your situation. Because not everybody needs therapy, but you also have to know when it's important.
I agree.
Yeah. So you mentioned COVID-19.
Yes.
So I saw your post on Facebook and you were talking about it and coming through it. what was that like when so did you find out because of symptoms, or were you just tested and you found out just randomly?
So the week prior, I had just went to San Francisco, and I'm not blaming San Francisco. I could have gotten it from San Francisco. I at this point, who cares how I got it?
Hmm.
But March 18th, I started getting very sick. I was waking up with fevers, with chills, with body sweats. I couldn't even get out of bed. My body started aching. So March 20th, I went to work. Um, and on the way back home in Staten Island, I got tested. 2 days later, I received a call from the Department of Health in the city of Bayonne, in New Jersey, and they indicated that I tested positive for COVID-19. And so in March 22nd, essentially it was the height of the pandemic. So
Right.
it had just started. So I tested number 8 in the city of Bayonne to
Wow.
to have contracted COVID-19. So I actually made uh, their official, newsletter or post that they wrote down, a 39-year-old male with number 8 with COVID-19. I had mild symptoms, but there were mild symptoms that lasted for about a month or so. So I had the coughing, a lingering cough, the shortness of breath. I couldn't even walk down the stairs to check my mail. I had to have family and friends go shopping for me to do food shopping because I couldn't leave the house. It was bad. So, but in terms of the mental health aspect, so I recovered from the COVID-19, but that left lingering anxiety. I was already suffering from anxiety, so it brought up more anxiety. Oh my God, I'm gonna die. I'm gonna die in my house by myself. No
Mhm.
one's gonna find me here. And then watching the news, uh, it didn't help at all. So I actually stopped watching the news because it was kind of bringing out more of the anxiety. Um, so yeah, so the mental health aspect was a big component, and I had to deal with that by myself. I had no other choice because the telehealth was there, but it wasn't readily available. Uh, and so I contribute a lot of the me overcoming this with my best friend because I would call him up every day. He would walk me through it. My cousin, who's a psychiatric nurse, she walked me through a lot of the panic attacks that I had.
Mhm.
Being in the house isolated by myself with COVID-19. So, but the anxiety was the biggest factor for me because it was hard for me to transition back into kind of normalcy, I guess. Uh, so yeah, so now I'm still kind of dealing with the anxiety because I'll still have a panic attack or some anxiety here and there, but it's not as bad as it was when I was suffering or recovering from the COVID-19.
So with all the anxiety and everything that happened, do you feel that perhaps you suffered well, not that you suffered, but do you feel that perhaps you dealt with PTSD in
I so
as a result of going through that on and having the anxiety being so heightened?
so I would say so, only because there was an issue. Well, so I had mentioned earlier that my father passed away through a traumatic experience. So
Mhm.
my father passed away, was murdered by police officers back in the early 2000s. Um, so with the pandemic going on and the riots and being isolated at home by myself, already suffering with anxiety, the PTSD definitely come out like significantly. Like I went for a bike ride um, just recently, about a month and a half ago, during the riots, and 25 miles into the bike ride, I had a really bad panic attack out of nowhere. I just was listening to music and riding in Jersey, and I had a really bad panic attack that I couldn't even just. I had to stop dead in the tracks.
Right.
So I put on some mindfulness music, and that actually helped me calm myself down and bring me back to the present moment. And I was able to bring myself back home on the bike. So, but yeah, definitely the PTSD was definitely there with the COVID-19, with the riots going on. So it was bad.
Well, let's talk about the riots because you just revealed how your father passed away.
Yes.
Um, the so the murder of George Floyd and other and other Black men at the hands of police officers. What effect did that have on you with the memories and with the story of your father's passing? How did that affect you?
Uh, so I remember clearly just around 2015. I don't remember his name. Uh, he was also killed by a police officer while smoking a cigarette, or for Lucy.
Okay.
Uh,
Yeah.
I forgot his name. So during that
Eric
time,
Garner?
yes, yes.
Okay.
So during that time, I started having a lot of panic attacks and anxiety. And I really never put two and two together until this time around with these riots. Um, so now I contributed the first time I started going through the anxiety, and this time around, the pattern is the riots, the police
Hmm.
brutality, and I'm contributing that might be a factor as to my anxiety, or a trigger to my anxiety.
So,
But right.
so I like to ask you advice because this is a conversation I have often with other media outlets and podcasts about overexposure, and now with the media, and not just the media, but with us posting everything and posting videos and repeating it all the time. What advice do you give people that can't seem to handle that overload?
In terms of the posting social media, I mean, people are going to do what they're going to want to do anyway. You know, I tend not to go on social media and see things that might trigger anxiety.
Mhm.
But people are going to do what they're going to do.
Well, I find it important that people understand their own triggers. Like for me, I know that I don't want to see a video. So when it comes across my screen, I skip it.
Yeah.
And I think we try to take on more than we can chew, but knowing at the end is going to hurt us. If you feel triggered, if you feel emotionally stammered at even just reading a detail about something, that's when you close your phone or you close your screen. You help yourself by understanding I should know my trigger. I shouldn't blame so and so who I've never met for making me upset. You know, as you said, folks are going to do what they want to do. And I've told people during this time, I've unfriended people who have a frequency or the
Mm,
tendency to post subjects or to post matters in terms of videos and things that trigger me. It's not against you, it's just that because I think I know what you're trying to do. You're trying to keep the message alive,
yep.
but there are other ways. So I said, let me unfriend them at least for a while because I can't take what you're doing. I
Yep.
can control what I see by either blocking it or temporarily hiding your post. And then also, you know, we have to tackle the subject of secondary trauma. Is that even though it hadn't happened to us, but if we relate to that person on a cultural level, on a spiritual level, on a gender level, on a race level, we feel so connected that it feels personal to us. And every time we view that, it brings up things that we can't handle on our own. And it brings up feelings that if you have a hard time dealing with the feelings that happen, while charged emotionally with these things, that's when you may also think about seeking help, because if you can't pull yourself out of it in a fast enough time, it can start to weigh on you. um, it can weigh on you in ways that can cause mental illness and disorders as well. So what is your opinion on that?
So I think one of the biggest advantages and disadvantages that make me a good psychologist is the fact that I'm able to relate to my clients.
Mhm. Absolutely.
So, um, so like example for the anxiety. I know what a client of mine is going through because I've been there. But and I'm also a worry wart. I worry about everyone. I worry about everything, and I tend to take everybody's issues onto me, which is the disadvantage part.
Mhm.
But again, I can also relate to my client, which kind of helps them, and it's helping me in the long run because I'm identifying a lot of my issues, and while also assisting them.
Mhm. Well, that makes sense. So I want to go back to mental health care for the Latino community. So one of the barriers to mental health care is sometimes they can't find quality health care. Like they can't find quality health care, and sometimes also depending on your insurance, they may refer
Hmm.
you to uh, to your family doctor or to someone who's not qualified just to get a referral, just to tell you who you think you should go to. do you feel that well, do you feel that that impedes the quality of healthcare that your community gets because they're having to go through so many channels just to get to good quality healthcare?
So it definitely does. So first, I just want to mention that a regular medical doctor should not be, they don't specialize in psychology or psychiatry. So they
Mhm.
shouldn't be prescribing psychiatric medication, right? So
Mhm.
a psychiatrist will be able to do that. Um, if they want to prescribe, let's say, Ativan for anxiety,
Mhm.
but anything else after that, it should be prescribed, or you should see a psychiatrist because they're the ones that specialize in the psychiatric component of medication to that, because they're able to identify whether they have counter effects. Certain
Mhm.
medications affect one another, but there's a lot of disparities in the Latino community in mental health, as we mentioned earlier. But
Yes.
the lack of documented, undocumented, I'm sorry, immigration status,
Mhm.
you know, um, or even the inability to understand what psychology or psychiatry really is,
Right.
especially with the Latino community, the older generations.
Mhm.
They weren't brought up to know what a psychiatrist or a psychologist is. Um, so those are the main factors.
Yeah, and I also think that when we talk about psychoeducation, which is what we're talking about, educating people in different things, if the psychoeducation is not geared towards that specific population, meaning when you're doing ads and billboards, or anything in literature, and it's not in their native language, because there are a lot of people here that don't speak the native language, so therefore things get lost in translation because they're trying to translate in English. And also when I feel, and this is just my opinion, when I don't see a lot of things catering to who I am, I feel like I'm not regarded. I feel like this is for the main population, but it's not for my population. So I don't feel seen. Therefore, why am I going to go see a therapist if I don't feel seen in the first place? So I
Yeah.
think that one of the things that we can do to improve that, again, is psychoeducation, in the easiest of ways. We have bus stops, in these neighborhoods. We have small billboards, we have signs. So hopefully we can see a rise in psychoeducation in that form, because usually the psychoeducation happens when you're in the office,
Yeah.
but we have to get you into the office. We have the same barriers, you know, in the Black community. We have some barriers that over 400 years we still haven't made a huge dent in yet. We haven't made a huge dent, and I'm not sure what more work we can do, but I think the work has to come from the other cultures that have control over those policies,
Yeah.
because we can ask for it, we can advocate for it, but we don't pull the triggers. So I think that we need the alliances from the Caucasians in order to say we feel that it's important for them to know this, or important for them to be fairly, to not just be fairly treated, but to also be fairly considered in mental health care practices.
I mean, I agree. I also think, like I said earlier, education is really important. A lot of the Latino families, uh, and getting therapy or psychology services, it's embarrassing to them.
Yeah.
So we have to educate the Latino community and the Black community that it's okay to seek help. It's okay to have a disorder, that's being controlled via medication,
Mhm.
but it's just education is really important, and I think once we overcome that barrier, it should make it a little easier within the cultures.
Now, how important is religion and spirituality in the Latino community?
It depends which Latino community.
Okay.
So you have, I'm assuming, so you have your there's a lot of religions, which is a whole different topic on its own.
Yeah.
um, uh, it's hard to decipher, but let's say, for example, you have the Catholic religion,
Hmm.
right? And you have the Santeria religion. You have the Christianity. So
Hmm.
it's every belief and every culture is different, in terms of what they believe in psychology and mental health. So it plays an important role, but that's something that it's very intensive.
Well, something I consider within the recent year, and when I regard, a person's religion aspect, and if they are so deeply entrenched in religion, and it's the religion that's keeping them from mental health, I now advocate for churches, especially Black churches, especially with a large base of people. Why don't you query your congregation and see who in your congregation can provide mental health services? Because if you're in the church, you have a commonality with that person, they
Hmm.
probably feel more comfortable going to someone, or make a mental health ministry, because we have so many ministries in church. We have the singles ministry, we have the finance ministry, but where is the mental health ministry? I think that would really help to bridge the gap between the practice of mental health and the reliance on religion. That's just my idea.
I could agree with you. I think mental health is definitely a subject that is overlooked. It's an important subject that, especially nowadays with everything that we're going through and what society is going through, um, there's not enough of mental health practitioners. There's not enough of mental health practitioners that know what they're doing.
Right.
You can pay $50 an hour to a therapist that has no idea what they're doing. But is it working? Is it helping you? That's a big question. Well, that's what we need to find out. But essentially, it's all about, it all comes down to education, right? Being able to identify the problem and say, hey, listen, I think I need help.
Mhm.
Finding the resources and say, all right, so I can go online and filter. I want a therapist that speaks Spanish. I want a gay therapist. I want a therapist that speaks Spanish, that is gay, that specializes in a specific part of psychology or
Mhm.
therapy, like PTSD, cognitive behavioral therapy, that sort of stuff. Because each approach is different for every diagnosis, right? So I wouldn't use CBT for a specific diagnosis because it's not going to work. For example, anxiety. You can use cognitive behavioral therapy, um, setting goals, being mindfulness. So on a personal level, I did my dissertation, my PhD dissertation on mindfulness. That's what helped me overcome my anxiety. So when I have a panic attack, I'll put myself down. I have a woosah moment and bring myself back to the moment, and that's what helps me overcome the anxiety and the panic. Not everybody knows that.
Well, no, well, and you said two important things in this. I want to. The first thing is, when you pick a therapist, sometimes the first time it doesn't work, and I think not when we, but I think what happens is sometimes when people try one person, it doesn't work. They think the whole practice is bogus or the whole practice
Yep.
sucks, when it really is just that you don't have that connection.
Yep.
Because the best relationships, or I would say this, the increased trust in your therapeutic relationship, that increases your outcomes. So it's not always about just the way that they do therapy, but does it speak to you personally? Do you feel safe? Do you feel comfortable? And some people have to go through two or three therapists to find that fourth one that says, wow, this is where I belong.
Yeah. So I recently went through that. I had a Caucasian therapist, a female
Okay.
therapist,
Mhm.
who, we had 2 sessions. I gave her the benefit of the doubt and said, we'll try for the second session, see how it
Mhm.
works out. If I get that vibe, I didn't. After the second session, so when you're doing therapy with someone, well, with a client, the conversation has to flow, right?
Yeah.
When the client gets stuck and has no idea what else to say, then obviously the conversation and the vibe is not there. So there were times where I'm like, okay, so what else do we want to talk about? You know? Um, so unfortunately, I had to let her go and tell her nicely, say, listen, it, it wasn't a fit. I had to find a therapist that fits my criteria in terms of that, that they're, the sexuality, that understands the gay culture, understands the Latino culture, and can kind of understand what I'm going through in terms of the riots and anxiety and COVID and all that. But so yeah, I had to let her go. So I had to find a new therapist.
Well, and I feel like, well, and I'm still in my studies, but I've been passionate about mental health for the past, I want to say 13 years, because of the work I've done as an advocate for men who have dealt with childhood rape. I've dealt with people who have gone through domestic violence and mental illness. So I've been an advocate, and I've also been on the forefront doing shows like this. Then I decided I want to study it, and I love it. But I also know that A, my oath is to do no harm, and B, every time I approach a client who um, I have to evaluate my biases. I have to evaluate because sometimes I have to realize I can't be as successful with a certain type of client because I have a bias that I have not overcome yet. And I have to be honest about that. So therapy is not a one size fit all, not even for the therapist, because sometimes the therapist has to say to a client, I don't think I'm the best fit for you.
Yeah.
So if a male client has issues with respecting women, it's ideally not a great idea to pair him with a female therapist.
I agree.
It's ideally not, but sometimes you don't find that out until you maybe 1 or 2 sessions in, and that's the issue. But then you have to say, I'm not here to save the world. I'm only here to save people that I can help. And that way you, as a therapist, had the opportunity to not do harm,
Yes.
instead of forcing something onto someone that just doesn't work for you. So I think it's very important that, for people who are entering the field to understand that you have your own biases because you're human, things that you've heard in your household, things that you've grown up thinking. And at that time, can you safely say, I can be of help to this person? And I also understand that that's why for the Black community, we have a hard time. Just like my clients are all Black men. I had 2 female clients and it was fine, but Black men are like, oh, you get it. Oh, you understand. Yeah, I was there. I'm still in the struggle too. Let's talk about the fact that you are a Latino, male, gay psychologist. That's at least 4 titles. At least 4 titles that you wear proudly. But it has to be something when you come across a person that didn't know that you could understand them. Not by just being Latino, not by just being male, but wait a minute, he understands me as a gay person. He gets what I'm about to say or what I will say. How has that been? How has your presence been impactful within that segment of population?
So, uh, outside of the suit and tie, one would never think that I'm a psychologist. One would never think that I'm a doctor, that I have 5 degrees, because, and you met me on social media, but you
Right.
would see I dress down, and that's
All the
part
time. All the
of,
time.
and that's part of being a good psychologist or a good person because you can relate to,
Yeah.
or the client can relate to you, so my presence, I guess, would be, it would be easier for them to relate to me, and to approach me.
Yeah.
Whereas, it's a little harder to approach a Caucasian, a therapist, or one that doesn't, fit their criteria, I guess. But yeah, so my presence, I guess, I'm assuming it's, so with the COVID-19, I posted a lot of social media videos discussing my COVID-19s and my symptoms and my experience. Until this day, I still get random text messages asking me, so how are you feeling? Or, I want to look for this. Should I look for that?
Mhm.
I tested positive. What should I do? I'm not a medical doctor. However, I can give you my experience and my advice. But yeah, so it's made a significant impact on those that I don't even know.
Well, and I do find out. Well, I do feel that is important that for us as mental health professionals that we are approachable, whether we are as approachable as possible. People only know that I do what I do because I'm on social media and I advocate and I'm doing all these great projects. But if you saw me in Target, you're going to get dad mode all the time. You're going to get sweat shorts and a t-shirt. And I think that sometimes we have to make ourselves as approachable as possible because again, it's already hard, especially for men. It's already hard for men to come forward, and it's also probably as difficult for gay minorities to come forward because they feel ostracized.
Yep.
They feel judged. What if the person is not perceived as masculine as society feels comfortable? Everywhere they go, they know eyes are on them. What if it's a trans person that has yet to become comfortable in their skin, but although they know that this is where they're supposed to be, I don't know who I can talk to because I don't know if they get me. So I think it is very important that we are as approachable as possible, because really I would have never known that you were a doctor unless I read your bio and your profile, because every day I see tank tops and gym shoes. So and it's okay, because it makes you relatable.
Yeah.
And right now we judge everything. We judge it, so we can go to a doctor's name and we can put it in Google and say, oh, they have a Twitter, oh, they have a LinkedIn, oh, they have an Instagram, they have a Snapchat, and let's see what this content is. And then, oh, because we don't know what they're judging us on. We don't know what criteria that they already know about us before they walk into our door.
Mm-hmm.
I was referred to I was referred by somebody for someone who had never met me. The person who referred me never met me, and the person I was helping never met me. So it was like, how did you find out? But I was like, wait a minute. If you Google my name, my face shows up. And so it's sometimes you have to kind of know how to wear the professional hat, while also saying it's okay to come and talk to me. It's okay to ask a question. It's okay to inquire, even if you're not trying to be in service, but perhaps you just have one question you need to have answered. So so because of that, how's the pandemic and the self-imposed isolation, how has that helped or hindered your work?
Well, I'm still working remotely. So I specialize in conducting psychological evaluations and psychosocial evaluations, specifically on the children population that are looking for services. So that stopped for a little bit. It's now picking up again. I'm starting to go back into the work field, into the world, and going to do evaluations. But it's we're still doing telehealth with psychosocials, because that really doesn't need in person. But the psychological evaluations is a little bit more intensive, and it's testing that I have to do. So that requires an in-person. Um, so it stopped again. It stopped for a little bit, but now it's picking up again.
So I asked you before, and so before we close, I like to ask you again. What mark do you hope to leave in the mental health care field? I don't know if you've ever thought about, oh, what my impact is when I'm done, but what do you hope your impact will be?
So I think it's exposure for me. I don't want my name to be out there. I just want the fact uh, that I want people to realize that mental health is not a stigma, right? And
Mhm.
we can overcome these obstacles. You just have to educate yourself.
Mhm. Well, I'm happy that your presence is here, because I feel that people who look like you, people who have your attributes, will feel more inclined and more comfortable after watching this. And who knows, hopefully someone watching this program will understand quite a few things. Maybe I can dream as big as him. It doesn't matter where I started. It matters most where I decide to end up. And one day I can be a Latino male doctor of some sort, helping people. Secondly, I can be a gay male Latino doctor. I can be impactful for my community that I choose to help. And thirdly, that mental health is wealth. That mental health is just as important as financial health, as important as physical health. And overall, all three of those things makes a sound and happy life. Well, first I want to thank you for taking time out of your day today to join us. And do you have any parting words for our viewers?
Well, thank you for having me. But I just wanted to just quickly close on saying that mental health, as you stated, mental health is wealth, and it's important to recognize and identify, and then fix the problem. It doesn't necessarily have to be a problem, but again, just being able to have someone to talk to is always a benefit.
And so again, thank you so much for joining us. And I hope that you continue on your path towards full recovery. And I pray that you continue helping those in your community. And thank you so much for joining us.
Thank you.